thinking about what tomorrow brings, but I could make some space just to listen to the morning show. It's time to listen to the morning show. It's time to listen to the morning show. So it's a mid-morning cruise on Rhythm FM. 94.7 is the mid-morning cruise on Rhythm FM. Abuja is the mid-morning cruise on Rhythm FM. 94.7 is the mid-morning cruise on Rhythm FM. Oh, yeah.
Tune in every Tuesday from 10:05 a.m. on the mid-morning cruise at Rhythm 94.7 Abuja as we discuss health-related issues and more. Remember, health is wealth. Powered by Nizamiye Hospital.
Yes, when you hear that sound, you know the Mid-Morning Cruise crew is here. Good morning, Abuja. How are you doing? This is the Mid-Morning Cruise with your hosts, Awesome Ann and Blossom Martins.
Beautiful morning, Abuja. It's another day for us to talk about your health. You know, health is wealth. So it's Healthy Tuesday. And we have a beautiful guest with us here in the studio.
Right, and that is the person of Dr. Khan. She's a gynecologist with Nizamiye Hospital. And today we're looking at something that nobody listening right now, and if you are not listening, you don't want to miss this topic because we're looking at infertility. And we know that infertility is plaguing a lot of considerably younger people as opposed to what we would have thought, 10 years ago, 20 years ago. It's a menace that is, almost ruining the lives of some people's relationships.
Definitely.
Yes? Right. So we're going to go right into it. Healthy Tuesdays is a 30-minute weekly program powered by Nizamiye, and today we're looking at infertility. So, Dr. Khan, you're welcome.
Thank you very much.
Yes. So I think we should just go right into it. First of all, let's define fertility.
Or should I define infertility better? Because fertility encompasses a lot of things.
Okay.
But infertility generally means inability to conceive within a year with young couples. However, the timing reduces for people that, like ladies, are older than 35 years. So for them, we give them 6 months inability to conceive within that 6 months, or someone that's not been able to take pregnancy to full term. That is also part of infertility.
Okay.
And generally, it's not just problem of the young people that you mentioned. It's actually affecting the elderly, or should I say the people above 40 years mostly nowadays, because most of us are career oriented and we are looking into marriages only after we have secured what we want to do in career wise. So basically it's now affecting the older age group. So yes, so that's what I would define as infertility.
All right, doctor, let's look at infertility in a woman.
All right. Yeah.
So what are the causes of infertility in a woman?
It's multifactorial. It's not just one factor that may lead to infertility, and it's only when we have identified or we have done all the thorough tests that we can now say it is female infertility. Let's get this right. Infertility, it's like the way it is right now, basically put as a blame on the female. It's not the case. In infertile couple is 40% male factor, 40% female factor,
Right.
20% unexplained. No matter how much we do or we try to, at least the investigation wise, nothing comes out of it, and they are still not being able to conceive.
Right.
So that is called unexplained. Now, coming to the female factors, there are lots of it, and there is something what we need to understand, the basic physiology of the whole process, reproductive process. It needs an intact pituitary gland, or should I say higher function, the brain, the ovary, the uterus. That is when we can now say that this is how a lady will be able to conceive successfully if all these three factors or three places are actually seen to do well. Function properly. Now, if there are any problems along this line, that is when we say that is where the problem of that female infertility lies at. Now, coming to major causes in Nigeria, basically we have the tubal factor being the number one problem, and the tubal factor generally is because of the tubes is where fertilization of the sperm and the egg actually takes place. So many people are able to produce a healthy egg. However, when it comes to fertilization, it's not possible because of either tubal damage, which has happened long time ago because of infections. Pelvic infections, even post-operative complications may lead to tubal adhesions. So these are some factors that are very common in our Nigerian ladies. And tubal factor, 1. 2, I should also say, even though it is not a pathological cause, but advancing age of the female is a cause of our ladies not being able to conceive spontaneously because of their what we call reduced ovarian reserve. Next, other things are ovulation problems. That is, a lady is not being able to release an egg, which is a monthly thing. And once that happens, we call it ovulatory factor problems. And these are also common. And other things may happen, such as uterine factors, which include presence of fibroids, but I don't really want to blame that every lady that has a fibroid will not conceive. Generally, surprisingly, many ladies are having fibroids in African ladies, and they're still very fertile. So I don't really blame fertility with fibroids, but generally, yes, some position of fibroids may affect a lady to have a successful pregnancy outcome, or even the presence of that fibroid may impede on implantation process. So again, the lady may have problems conceiving.
All right, doctor, you've said so much about the factors that cause infertility in women, but I want to look at common signs, okay? I used to have a friend who have irregular periods, and as well, I also know someone who normally did not see a period for a period of 6 months and all that. So a lot of people will tell you these are signs that, okay, this lady is not fertile, or this lady has infertility and all of that. So I want you to point out these little signs that could lead, that people could point out, normal signs that nature could bring, and they'll say that this lady is not fertile.
Truthfully, frankly speaking, it's not like malaria where you say that somebody has fever, body pains, and that's malaria without even doing the basic test. Infertility, unless you do the test, that is only time you get to know the lady has a fertility problem. So it is not by having irregular menses. Yeah, she does have a menstrual problem. That is all, but not infertility problem. It has to be investigated because, you see, let's get it right. Terming someone to be infertile is a very big emotional stress on that patient. And psychological, something we cannot just diagnose by looking at someone's face and saying, oh, these are your symptoms, and is equal to infertility. That's why when we are managing infertility, it is not one-man show. It's basically a multidisciplinary thing again. We should have involvement of the couple, even the gynecologist, yes, but again, we should have a psychologist with us, because some people can just break down by hearing that they're infertile. So it's not just like that. And so we need to be very thorough about the whole thing and saying, this is it. Some people may have menstrual irregularities all their life, but when they meet, it might be the first shot and they get pregnant. So basically, there's nothing like, okay, these are telltale signs that this person will be infertile.
Right. Okay, so let's look at male infertility, because I know there's a notion most men don't even want to admit the fact that the infertility might be from their ends. There's always a drag, if there's a couple. So let's look at male infertility.
I will talk briefly on it because that is not my domain. It's usually the urologists that talk about it.
Okay.
But I would generally say that, like initially what I mentioned, that it's a 40% cause of couple infertility. So we must always remember when a lady presents to the gynae, usually it is always the female that presents when there's a problem of infertility in the family. No, it's always like it's the female that caused it. It's blamed as the blame factor generally. So she presents herself, and I always emphasize there's never a direct relationship between infertility and the female only. It's male do play a very major role as well, and they should always be investigated, and it is something that every gynecologist know. Once a lady presents herself, the gynecologist should inform the woman, please involve your male partner as well. And the male partner, generally there are lots of simple tests which includes a semen analysis, plus depending on his other presentation to the urologist will again define what more tests to be done. But male infertility is quite common. Like I said, 40% do contribute male factor infertility. So I think they should not be exempted from any time there's a consultation taking place.
Right. Doctor, okay, you talked about male infertility, but I still have to draw you back to female infertility.
Sure.
Okay, I used to know that a lot of people say that there are some foods that boost fertility. I want you to speak on that particular aspect. Are there foods that you eat and it helps to boost a woman's fertility? Yes.
Well, I would not really say fertility per se, but anything that, builds up toxins in the system will lead to, whenever there are toxins, they do affect wherever there is hormonal function taking place, whether it is in the brain or the ovary or anywhere, even the thyroid are affected by toxins, by consumption of toxins, high carbohydrate diet, refined, all these are sometimes related to production of toxins. So generally, any consumption of food that is not healthy will lead to production of toxins, which may affect this hormonal area, the glands, and thereby reducing the hormones that we are looking forward, such as the estrogen and the progesterone. So basically, I don't really have a word to say, yes, these are fertility fertility boosting food, but generally good healthy food diet, balanced diet will help this whole system, which includes helping out the glands, helping out our ovary and everything. So I think these are what I will emphasize on. There's no specific, so I don't want a lady, because I hear when I was in down Ibadan side that if you eat cassavas and you eat yam, you're going to have twins. I mean, that is also poisoning yourself with so many other things. Like I know that cassava has cyanide in it. So just because you want to go for a twins doesn't mean that will boost. It may, however, maybe have effect on other things. Right. So let's just have a balanced diet, which is very important. And actually, fertility is just like a natural thing. If you want to be healthy, you just want to be fertile, you just want to be healthy. And the basic core things to remain healthy is 1, have a healthy diet. 2, have regular exercise. This is very important. Keep yourself hydrated. Drink lots of water. And that way you flush out the toxins. So this is what I would consider as being healthy diet for fertility boost, which is actually for boosting our health.
Right, fantastic. That has been an amazing ride right there. The first 15 minutes, fire. Just in case you're just tuned in, this is Rhythm 94.7, the mid-morning cruise, and it's Healthy Tuesdays. Today is the 29th day of January 2019, and we've got Dr. Khan, who is a gynecologist from Nizamiye Hospital, here with us. And so far, we've looked at what infertility means. We've looked at how we can identify the problems through testing. We've also looked at factors that might contribute to infertility in women, looked at things like advancements in age. We've looked at ovulatory factors. We've looked at uterine factors, which might include fibroids, but not all fibroids, can be attached to infertility problems. And we looked at the tubal factor. So let's go all the way to the increase in the risk of infertility in women. What are those things that might increase the risk of a woman having infertility?
Looking back at the factors that cause infertility, you see prevention is very important in anything. So if you want someone to have, we want to prevent infertility in a lady, even though you see we have unexplained factors as well, where we don't even know why somebody is not able to conceive, even though all the tests are good. So we can't really 100% say by doing this, you will be 100% sure of being fertile later in life. It is just a way of be conscious about what you're doing. First and foremost is that prevention of infection is very, very important, especially in our young girls, because that is the age of experimentation with sex, and also lack of basic sex education leads them to having frequent and pelvic infections. And these infections generally are not treated adequately and properly. That leads to chronic infections, and that now causes the dreadful effect which we call tubal factor problems, and they are the ones that lead to later in life having problems and not being able to conceive if this is the factor that actually is the cause of infertility in life. So basic thing starts from where? Basic education. They should be learned. Most people, at least the ones that we know that are going to be quite early into, we should start giving them some sex education in schools, telling them what to do. I'm not saying first thing is condom. No. First thing is always abstinence. We should preach abstinence. Be careful. Be faithful. See what is condom. So that is what I will advise them as early as they can be. It can be taught, like the young girls, 9 to 13 years, basically, because most of them are into experimenting age, and that is when we should target it. It's not when they are already having the infection that we start preaching to them about, you should have been careful, you should have used a condom. No, it should be done even prior to their initiation. And that is why home education is important. School education involving such factors are important. Now, that is to target the tubal thing. Next important thing is that if someone is infected, they should also have the health-seeking attitude. Chemists are so common. Not only talking about chemists, we have roadside vendors giving out antibiotics to people, and that is absolutely not right. So, because I went to drop one of my house help at the bus stop, and I saw a bus vendor giving out Augmentin to a patient, and I was wondering that how can a bus vendor that knows nothing about drugs be selling, and moreover the drugs were exposed, he was selling with open basket, like in a basket, and show the temperature, everything. Yes. And that lady would feel that she's getting the right drug, so she would not go to the right place to get this drug. She would not even be given the right dose as well as the right amount, the appropriate dosage. So you see, these are very important things we should start informing our people about, and that's very important. Health-seeking attitude should be improved, and that is by going to the right places. And the right place to go for is at least the basic GP, which is, I think, commonly available in every hospital, government hospital, bay, whatever. I know sometimes it's quite frustrating. You may not see immediately, but at least it's better than seeking a vendor on the road or a chemist that knows nothing about what she's giving you. So if we can reduce that would be a boost to reducing the tubal problems. At least infection will be under control. They'll be treated adequately and properly. And it's not a matter of uneducated people. It's a problem that runs across every strata. Educated ladies as well, they have seek such help. And I think we should look into ourselves and seek appropriate health-seeking change in our attitude towards that. Next thing is that, you see, I understand fibroid cannot be changed. It's something that's genetic most of the time, but at least if we know that this thing is there, and still have a lady that is about 20 years old, and she's carrying a mass of almost 20 weeks gestation. I've been talking to her, but just the fear of surgery is, put off everything, and that would affect her future fertility, in the sense that the position is not in a place that is supposed to be. I know it's not every fibroid that needs operation, but at least when you're meeting the right person and is explaining things, that fear that it will affect my future productivity because I won't be able, my future fertility because of an operation, that will even disturb, the presence of it may even further destroy it, rather than you keeping it there and having problems to do an operation much older age. So it is easier and even better when the fibroid is a bit smaller, but the position will now be the one that will now tell us when to operate and the appropriate timing.
Oh, fantastic, doctor. You've said so much. All right, in case you're joining in, the number for you to call to ask your question is 081-780-947, 081-78-000-947. Do you have any question with regards to infertility in women or infertility in men? Go ahead and call us up and ask us questions that with that regard. Okay, doctor, I want to ask, okay, couples get married and after a year or two, there's if they don't get pregnant, there's always this shift that it's either the man is infertile or the woman is infertile. But let's take this call. After this call, I'll continue with my question. Hello, good morning. Hello, good morning. All right, tell us your name and where you're calling from.
My name is Peter. I'm calling from Abuja.
Okay, so go ahead with your question.
Okay, you might have to call us back, 081-78-000-947. Hello, good morning. Go ahead, we are here. Good morning. Okay, I think the network is playing games with us this morning, but just keep trying. And if you can't get us, you can send us a message to the same number, 081-78-000-947. Healthy Tuesdays.
Okay, so doctor, how long should a couple wait after getting married before they get worried that, okay, there's an infertility problem from either me or my wife?
Oh, like I said earlier on, it has to be like age related. If anybody is less than 35 years, a female is less than 35 years, she should just have 1 year of unprotected sex. That means 1 year without having to use condom or birth control pills or anything, and she's not been able to conceive. However, the frequency of having sex is also very important, at least 3 times a week. So some people just have it around their ovulation time. That's absolutely not good. You should always have that, because once you are doing it under pressure, you may not really achieve what you want. So it should be done freely, and it should be done 3 times at least a week for 1 year unprotected. Then she should seek help.
Right, let's go back to the phone lines. Hello, good morning.
Good morning.
Morning to you. Please turn off your radio. Turn it off.
Okay. My name is Felix. I'm calling from Central area, actually.
Okay, Felix, go ahead.
Okay, please. I had an infection some time ago, and then the chemist people just give me some. The infection was I was having small pox on my private part. I'm a man. So after some time, the chemist people just give me some drugs and they said I should take them. After taking them, the pain still continue and they give me another one I take. So after sometimes it stops, and then after a short period of time again, after having after ending my sometimes I end my urine with some little blood, as in it will change to a bloody color like that. So I'm just wondering, but now as I speak now, it doesn't come regular like that. It's once in a while I will see it. I will see the ending part of my urine with little blood like that. But it's not regular. So I don't know. Is it going to be something else? I don't just know. But if I go to them, they still give me drugs and it still continues like that.
Okay, Felix. Just keep listening, all right? She's a gynecologist, but I'm sure she'll be able to put you in the right direction.
Okay.
Thank you, Felix. Yeah, so he started off with observance of pores in his private area, and then went to the chemist. You just finished speaking about going to chemists and all these places. So just to put him in the right direction, he's taking those drugs.
The truth is that, you see, he needs to, my advice to him would be let him seek proper care at a proper place in the hospital.
Right.
And he's not just going to be given drugs right away. He needs to undergo some tests.
Right.
Basic tests, urine tests, you know, the swab test. So let him do that first.
Okay.
Whatever the results of the test results comes out like sensitivity pattern, then he will be given appropriate treatment for that.
Okay.
If he doesn't take care, it will affect him, obviously, not only because of fertility, but because of reoccurrence and other problems that he may have. So I think it's important that he called in. It's good for him that he did, and then I will just let him know he should just seek immediate medical help. Yeah,
Right.
he should. It's not as if it's an emergency,
Right.
but it is something he should, because it may affect his personal being. So it's not only because of infertility issues.
Right.
Yeah.
Okay. All right. So let's go and find out, is infertility related? Like, can it be hereditary? Can it be traced back to, your father, grandmother, grandmother? No?
It's not a genetic disease.
Okay.
It's nothing like, because my mom did not have, obviously my mom was fertile enough to have me.
Right.
So, but there's nothing like there's an infertility problem. Generally, yes, you may have some issues. You may not have, like when we can have genetic problems that may cause infertility problems. But it's not because infertility is genetic. There's nothing genetic. Do you understand?
Right.
What I'm trying to say is that when you are investigating the couple, there might be something in the male or the female that may not aid their fertility together. You understand?
Yeah.
Maybe fertilization may be a problem because of some anti-sperm antibodies or something. That is a different thing. It is genetic, but it is not a genetic disease.
Right.
Per infertility. No, it is just a cause that has led to it. Now, if she meets someone else or the sperms are of a different person, maybe that issue may not even arise. So it is not a permanent stamp that, it's never going to be possible for her to conceive.
Right.
Yeah, it's just that it doesn't just go with that thing.
Okay.
All right, doctor, let's talk about abortion and infertility.
Yeah.
Okay, a lot of people have abortion and at the end of the day, they find it difficult to have children later on in life.
Yeah.
So is abortion connected anyway to infertility?
Yeah, let's get this right. When you have abortion, there are two types. We have induced and spontaneous. When it is induced, and especially when it is done in, under conditions that are not too good, which would mean in septic conditions, probably done by amateurs or done by quacks. So such things may lead to complications. And these complications, the number one complication we are talking about is infection and damage even to our reproductive system in the procedure that was done. Now, all this, obviously, the sequelae and the final effect would be infertility and problems in the female. Yes, so in that way, yes. Now, if someone has a spontaneous abortion, miscarriage, maybe because of some issues, unrelated to termination, do you understand? Now, that could not be, I would not really say that would be a cause of infertility in a patient. But yes, if she had a miscarriage and she was not adequately, properly treated by a physician, obviously under treatment can lead to infection. And final thing would still be the same thing we're talking about. Tubal.
Okay.
All right, so that's it. So basically, infection is the major problem that
yes.
we face after if we have inadequate treatment. And also prophylaxis. Sometimes we have some procedures done without giving adequate prophylaxis.
Okay.
So that can lead to infection again. So again, abortion process, if it's not given prophylaxis, if we would think the patient requires one, we should always offer.
All right. Okay, in case you're just joining in, the number for you to call to ask your question is 081-780-947, 0817-800000947. In case you want to ask any question with regards to infertility in either men or women, go ahead and call us up. The gynecologist here in the studio is here to answer all of your questions.
So, Karen, it's been so nice talking to you, but I want to go back to the issue of fibroids. I just got a message now, and someone is asking if there's something, at the early stage when you discover you have some certain kind of fibroids, that she's being told that she can take drugs and the fibroids can go away. I don't know, how true is that?
Yes, we do have medical treatment for fibroids, but generally the fibroid medical treatment has its own potential side effects, which again is the gynecologist that will discuss with the patient and her willingness to continue with the medical treatment. Sometimes medical treatment is just to shrink the fibroid to its size that it is feasible for the surgery to take place. Sometimes we are using medical treatment just to to reduce the symptoms and everything the patient is going through. And sometimes, because one of the side effects is menopause may be tipped in earlier with the use of the drugs. Now, if somebody is 42, 43, we know menopause is around the corner. By using these drugs, we are helping her with the symptoms. We are also helping her to shrink the fibroid, and she's not really worried for fertility. Then this treatment is in place.
Right.
But if a young girl and she's eagerly looking for fertility, or a young lady, obviously these are things she has to consider, because every treatment has its pro and the con. So it has to be discussed and individualized with the doctor. So it's not just a blanket system statement, please do take or do not take. It depends on her situation, her condition, and how the doctor sees it.
Okay.
But she has a right to understand that we use it. There is an option of medical treatment for treating fibroids,
Okay.
but it must not be done more than necessary, because it can tip the lady into menopause as well.
Okay. That's clearly understood. I'm sure she's listening. Right. So I want to go right into the next question, which will be, when you now make the consultations and you find out that you're infertile, especially for a woman, what do you advise the next steps to be?
The doctor will advise on whatever the problem might be. You see, if it's a tubal factor problems, you see, again, how is the patient presenting, at what age? If somebody is presenting already at 40 years of age, she has less the ovarian reserve, which we call the quality of her eggs is also reducing. We don't have much time. We should offer her safer, faster procedures which can fasten the process of her to get fertile quickly. And for such people, I rather offer IVF options. Now, sometimes, yes, we do have tubal surgery options, but generally they're in the hands of the experienced. Yes, their outlook has been good, but I would prefer that because that is my own way of thinking, IVF seems a better option. Now, sometimes you don't really have to offer IVF. It depends again on like I said, on what is really causing the infertility. If it is ovulation problems, there are ovulation induction drugs which she can be placed on and then monitored. But yes, close monitoring is very important, and most patients seek advice from friends who had similar problems and start taking the drugs, which is wrong, because taking the drugs may lead to some complications which the doctor is following again. So by the time you miss out, you may probably run into more trouble. So it's always a consultation with a gynecologist that you further whichever treatment you're going to go in for, not that you just read on Google and start taking your own. Right. I know most of these fertility drugs are available over the counter, and they go in for it without knowing the side effects. Right. So I think it's important, consultation very necessary.
I think that last line right there is how we're going to end the show today. Consultation is very important. I've had different people come to me asking me different questions. I'm not even a doctor. I'm not even anything near a doctor. And to hear a doctor say the first thing you should do is to go and consult with a professional, definitely. I think that is the most important thing. So many people will come up with their own ideas. So many people will be telling you based on what they've experienced. I feel like everyone has their bodies differently. You know, your anatomy is different. So I don't understand how one Blossom's prescription will work for Awesome Ann, or Awesome Ann's prescription work for Dr. Khan. No, I don't think that works. I don't think it works.
Every doctor has his own way of doing things. Yes, we have protocols that we follow, and so again, it's not good to mix up protocols of different doctors.
Right.
The way I handle my patients might be different from another doctor's way of handling things. Absolutely. But that does not mean he's wrong. He's right in his own way. So that's what I will say.
Okay, thank you so much. I've gotten a couple of messages as to where Nizamiye is located, so you can find them at plot 113 Sector S Cadastral Zone, Life Camp Abuja. Yes, and then of course they are present on Instagram, so you can go there and ask your questions. Yes, that's the much we can take for now. We're so grateful Dr. Khan was able to come over and educate us and squash all those ideologies we have in our heads, clarify them. Yeah, thank you so much for making it on the show today.
It's a pleasure.
Hopefully we'll have you another day talking on a very interesting topic too.
All right.
Right. So,
and which topic would that be?
We'll find out. So we don't want to let the cat out of the bag.
No, so that our viewers.
Yeah. No, we always definitely put it out just before time. Yes.
Okay.
Yeah, it's still.
Okay.
All right, the mid-morning cruise continues with Awesome Ann, Blossom Martins. I wish Dr. Khan could say, but I'm sure she has patients waiting for her right there in the hospital. All right, take care. Yeah, bye.
You.
Abuja. One place. Got your attention. Rhythm 94.7. Nigeria's more music FM station.
We on? 1, 2, 3, go! Waking up in a dream.